Hello, my name is Dr. Emily Carter, and today we're going to talk about something that could save your independence and your life. If you're over 75 years old, you need to watch this video all the way through, because I'm going to show you 5 balance tests that you can do right now, at home, without any equipment whatsoever. And if you fail any of them, this isn't just a warning sign, it's a clinical indicator that you're at real risk of falling in the coming months. I know that sounds scary, but I need to be honest with you because falls after age 75 aren't random accidents. They follow a predictable medical pattern. And the good news is, we can identify that pattern before something serious happens. Let me explain what's happening in your body right now. After age 75, 3 fundamental systems begin to decline simultaneously. And this is why balance becomes so fragile. The first system is your vestibular system, located in your inner ear, responsible for sending signals to your brain about the position of your head in space. With age, the hair cells inside this system start to die and don't regenerate, so your brain receives less information about where you are and where you're moving. The second system is proprioceptive, which involves sensors in your muscles, tendons, and joints. These sensors tell your brain where your feet are, whether the ground is level, whether you're leaning forward or backward. After 75, these sensors become less sensitive, which means you could be losing your balance and your body doesn't even notice in time to correct it. The third system is visual, and although your eyes still work, your brain's processing of visual information slows down, so you see the obstacle, but your body reacts with a delay. When these 3 systems fail at the same time, you enter what we call the fall risk zone, and that's exactly what we're going to test today. Each test I'm going to show you evaluates one of these systems or the coordination between them. If you fail one test, it means that specific system is compromised. If you fail 2 or more, your risk of falling in the next 6 months increases dramatically. And this isn't an exaggeration. This is scientific data. But here's the important part. Failing these tests doesn't mean you're doomed to fall. It means you've identified the problem before it turns into a hip fracture, a head trauma, or worse. And when you know where the problem is, you can work specifically on that system to reverse the risk. Before we begin, I want you to know that it's not your fault if your balance isn't what it used to be. This is biology. This is aging. This is completely normal. But normal doesn't mean inevitable. You can do something about it, and that's exactly why we're here. So grab a sturdy chair, keep it close for support if needed, and let's start evaluating your balance right now. Each test takes just a few seconds, but what you're about to discover could completely change your quality of life in the coming years. The first test we're going to do is called the single leg stance test, or simply standing on one leg. This is considered the simplest and most revealing test for detecting fall risk in people over 75. The execution is straightforward, but I need you to do it exactly as I'm going to describe, because any variation can alter the result. Stand with your feet together, arms loose at your sides, and position yourself near a wall or sturdy chair, but without touching them. Now choose one leg, lift your foot about 6 inches off the ground, without bending your knee excessively, and try to hold this position for as long as possible. Don't hold on to anything. Don't spread your arms out to the sides seeking balance. Just keep your arms relaxed and mentally count how many seconds you can stay in this position before needing to put your foot back on the ground or touch the wall. Now I'm going to tell you what this test is evaluating and why it's so important. When you take one foot off the ground, all your body weight transfers to a single base of support. At that moment, your vestibular system needs to work at high speed to detect any minimal body oscillation. Simultaneously, the proprioceptive sensors in the sole of the supporting foot, in your ankle, knee, and hip, need to send constant information to the brain about postural micro-adjustments. And your brain needs to process this information and send motor commands to the muscles in your leg, core, and back to keep you vertical. All of this happens in milliseconds, and if any part of this circuit is slow or damaged, you're going to sway and fall. Here's what medicine considers safe. If you can stand on one leg for at least 10 seconds without swaying, your static balance is within the expected range for your age. If you can stay between 5 and 10 seconds, you're in the attention zone, which means your fall risk exists but is still moderate. But if you can't maintain balance for even 5 seconds, or if you need to hold on immediately, that's a red flag. Clinical studies show that people over 75 who can't stand on one leg for 5 seconds are 3 times more likely to suffer a serious fall in the next 12 months compared to those who can hold the position for 10 seconds or more. Now think about how many times during the day you stand on one leg without realizing it. When you put on a shoe, when you climb a step, when you get into the shower, when you bend down to pick something up off the floor and rise using just one leg to propel yourself. If your single leg balance is faulty, each of these situations becomes an opportunity for you to fall. And the problem is that in real life, you're not prepared. You're not concentrating. You don't have a wall beside you. You're distracted, rushed, on a wet or uneven floor. And it's in this context that falls happen. That's why this test is so valuable, because it exposes the fragility of your balance in a controlled situation, allowing you to become aware of the problem before it becomes a medical emergency. If you failed this first test, don't be discouraged. Recording this result is already a huge step because now you know where you need to work. Specific ankle strengthening exercises, proprioceptive training, and progressive balance exercises can reverse this fragility in a matter of weeks, but you need to start now, not after you've already fallen. Now let's move to the second test, which evaluates something different. Your dynamic balance, that is, your ability to maintain body control while in motion. This test is called tandem gait, or heel-to-toe walking in a straight line. To execute it correctly, imagine there's a straight line on the floor in front of you. You're going to walk on this line placing one foot directly in front of the other, so that the heel of the front foot touches the toes of the back foot with each step. Do this for 10 consecutive steps, keeping your arms at your sides and looking forward, not at your feet. If you step off the imaginary line, if you need to spread your arms for balance, if you need to stop midway, or if you feel like you're going to fall, the test is considered failed. This test is critical because it evaluates something the first test doesn't capture: your balance while your center of gravity is moving. When you're standing still on one leg, your brain has time to make adjustments. But when you're walking, especially on a narrow base like heel to toe, your brain needs to anticipate the movement, transfer weight smoothly, constantly adjust posture, and do all of this while processing visual and spatial information. For a person with all 3 balance systems intact, this is automatic. But for someone over 75 with vestibular, proprioceptive, or visual decline, this task becomes extremely difficult and even impossible. I'm going to explain exactly what your body is doing during this test. With each step, you're creating a phase of purposeful instability, because when you lift one foot and move it forward, there's a fraction of a second where you're almost falling forward. Your brain needs to detect this instability, activate your core muscles to stabilize your trunk, adjust the supporting foot to compensate, and land the front foot in the correct position before you actually fall. All of this needs to happen in a coordinated and quick manner. If your vestibular system is slow, you don't detect the sway in time. If your proprioceptive sensors are weak, you don't know where your foot is in space and end up stepping off the line. If your visual processing is compromised, you can't maintain spatial reference and lose orientation. In clinical practice, this test is one of the best predictors of falls in real environments because it simulates situations you face every day. When you walk down a narrow hallway, when you need to dodge a piece of furniture, when you turn your body while walking, when you climb stairs or go down a ramp, you're using exactly the same skills tested here. And if you can't do 10 heel-to-toe steps on a flat, safe surface, imagine what could happen when you're on uneven pavement, on a slippery floor, or in a poorly lit place. The fall risk multiplies exponentially. Studies show that people who can't complete the tandem gait have 5 times more risk of falling during daily activities compared to those who complete the test without difficulty. And here's the important detail: these falls don't happen because the person is careless or distracted. They happen because the balance system is objectively compromised and can't respond to the demands of movement. If you failed this test, you've just identified a concrete risk that can and should be worked on with gait exercises, coordination training, and core strengthening. Don't ignore this sign. The third test is what I consider one of the most important for preventing falls inside the home because it evaluates something you do dozens of times a day, sitting down and standing up from a chair. This test is called the 5 times sit to stand test. To do it correctly, Sit in a chair of normal height, with your feet flat on the floor, hip width apart. Cross your arms over your chest and, without using your hands for support, stand up completely until you're upright, and then sit back down. Repeat this 5 times in a row, as fast as you can safely, and count how long it takes you. Ideally, you should be able to do the 5 repetitions in less than 15 seconds. If you take more than 15 seconds, or if you need to use your hands for support at any point, or if you feel you can't get up without help, this indicates that your functional strength and neuromuscular control are compromised. Now let me explain why this test is so revealing. When you stand up from a chair, you're executing one of the most complex and demanding movements from a biomechanical standpoint. First, you need to lean your trunk forward to shift your center of gravity over your feet. Then, you need to activate the muscles in your quadriceps, glutes, and calves in a coordinated sequence to generate enough force to lift your entire body weight against gravity. And at the same time, you need to maintain balance during this transition, because there's a critical moment where you're no longer sitting but not yet completely stable standing. If any part of this chain fails, if your muscles are weak, if your coordination is slow, if your balance is poor, you're going to sway, you're going to need support, or worse, you're going to fall. What makes this test even more important is that most falls in people over 75 happen inside the home, and a significant percentage of these falls occur during postural transitions. That is, when the person is moving from one position to another, getting out of bed, getting up from the couch, getting up from the toilet. All of these are high-risk situations, and the problem is that over the years, leg muscles lose strength, a process called sarcopenia, and at the same time, the nervous system loses the ability to activate these muscles quickly and in a coordinated way. The result is that a movement that was once automatic and easy becomes a real physical challenge, and often the person only realizes this when they're already falling. If you took more than 15 seconds to complete the 5 repetitions, or if you needed to use your hands, this doesn't just mean you're weak. It means your body doesn't have enough functional reserve to handle unexpected situations. Imagine you're sitting and suddenly need to get up quickly because the kettle is whistling or because someone rang the doorbell. If you're already at the limit of your capacity during a controlled test, in a real situation of hurry or distraction, the fall risk is extremely high. And what's most concerning is that falls that happen during postural transitions tend to be more severe because the person falls from a greater height and usually hits their head or hip on the floor with full force. The good news is that muscular strength is something that can be recovered at any age. Squatting exercises, progressive sit-to-stand training, specific strengthening of quadriceps and glutes, all of this can drastically improve your performance on this test in just a few weeks. But you need to start now, because the longer you wait, the more strength you lose, and the harder it becomes to reverse the situation. Now let's move to the 4th test, which evaluates something many people don't even realize is a fall risk factor: your reaction time and your ability to quickly recover from an imbalance. This test is called the step test. To execute it, you need a low step, approximately 4 to 6 inches high, or you can use a sturdy stool or even a stack of thick books. Stand facing the step with your feet together and place your entire right foot on top of the step. Now, step up completely onto the step by supporting all your weight on your right leg and bringing your left foot up to meet it. Then, step down by returning your left foot to the floor and then your right foot. Repeat this as fast as you can safely for 15 consecutive seconds and count how many complete repetitions you can do. The expectation is that you can do at least 8 repetitions in 15 seconds. If you do fewer than 8, or if you need to hold on for support, or if you feel unstable during the movement, this indicates that your neuromuscular reaction time is slow. This test is fascinating because it exposes a problem that usually goes unnoticed until it's too late: slowness in nervous system response. You see, when you're stepping up quickly, your body needs to make balance adjustments in fractions of a second. You need to detect that you're leaning forward, activate the supporting leg muscles to stabilize, coordinate the up and down movement, and do all of this at high speed. If your nervous system is slow, which is extremely common after 75 due to declining nerve impulse conduction speed and loss of synaptic connections, you simply can't make the necessary adjustments in time. The result is swaying, instability, and eventually falling. Let me give you a practical example of why this matters so much. Imagine you're walking on a sidewalk and suddenly trip on a small irregularity in the pavement. Your body detects the imbalance and needs to react immediately to prevent the fall. If you have a fast reaction time, your muscles will contract instantly, you'll take a large step to recover your balance, and you'll continue walking as if nothing happened. But if your reaction time is slow, there's a delay between the moment you start to fall and the moment your muscles react. That delay of half a second or 1 second can be the difference between recovering and hitting the ground. And the problem is that this delay is invisible in daily life until you need it in an emergency situation. Studies in neuroscience of aging show that after 75, brain processing speed decreases by an average of 20 to 30%, and communication between the brain and muscles through peripheral nerves also slows down. This means that even if your muscles still have strength, even if your static balance is good, you may not be able to react fast enough when something unexpected happens. And here's the scary part. Most serious falls happen in exactly these unexpected situations. It's not when you're paying attention, walking slowly and carefully. It's when you're distracted, rushed, or when something unforeseen happens and your body needs to react instantly. If you had difficulty with this test, if you did fewer than 8 repetitions or felt slow and uncoordinated, this is a clear sign that your reaction time needs work. And the good news is that agility training, plyometric exercises adapted for your age, specific step training, all of this can significantly improve your neuromuscular response speed. It's not something you fix overnight, but with consistency, you can drastically reduce the risk of falls caused by slow reactions. We've reached the 5th and final test, and this is probably the most challenging of all because it evaluates something many people don't even realize affects balance: your dependence on vision to stay stable. This test is called the Modified Romberg Test, or Romberg Test, with eyes closed. To execute it, stand with your feet together, arms at your sides, and position yourself near a wall or support in case you need safety. First, maintain this position with your eyes open for 10 seconds and see if you can stay stable. Now comes the hard part. Close your eyes and try to maintain exactly the same position for another 10 seconds. If you start swaying immediately, if you need to open your eyes, if you take steps to the side, or if you need support, this indicates that you have excessive visual dependence to maintain balance, which means your vestibular and proprioceptive systems are severely compromised. This test reveals something fundamental about how your body maintains balance. When your eyes are open, you use visual references to know if you're tilting forward, backward, or to the sides. Your brain looks at objects around you, detects if they're moving relative to you, and makes constant postural adjustments. But when you close your eyes, this source of information completely disappears, and your body needs to rely exclusively on the vestibular system of the inner ear and the proprioceptive sensors in your legs and trunk. If these two systems are weak or damaged, you simply can't know where you are in space and start swaying immediately. And here's the danger. There are many situations in real life where your vision is temporarily compromised. When you wake up in the middle of the night and go to the bathroom in the dark, when you're in a poorly lit environment, when you close your eyes to put in eye drops or wash your face, all of these are situations where you're temporarily without vision and need to rely on other balance systems. People over 75 who fail the Romberg test with eyes closed have a dramatically increased risk of nighttime falls, which are particularly dangerous because they happen when the person is alone, drowsy, and in an environment where hitting their head or hip can have fatal consequences. And the problem is that many people don't even realize they have this visual dependence until they take this test. They think their balance is good because they can walk and do their activities normally during the day, but actually, they're just compensating for the weakness of other systems by using vision excessively. And when vision isn't available, the body simply can't stay stable. If you failed this test, don't panic. Balance training without vision, specific vestibular exercises, and proprioceptive strengthening can drastically reduce this visual dependence and make you much safer in any environment, with or without light. But you need to recognize that this is a problem and start working on it now. Now that you've done all 5 tests, I want you to stop and think honestly. How many did you fail? If you failed 1 or 2, you're in an attention zone and need to start working on these weak points immediately. If you failed 3 or more, your fall risk is high, and you need to consider this a health priority, as important as controlling your blood pressure or blood sugar. But here's the message I want you to take from this video. Failing these tests isn't a sentence, it's a diagnosis. And every diagnosis brings the opportunity for treatment and reversal. You don't have to accept falls as an inevitable part of aging. You can do something concrete, measurable, and effective to reduce your risk. Start today, work on these systems, retake these tests in 4 weeks, and watch the improvement happen. Your independence, your safety, and your quality of life depend on it. If this video was helpful to you, share it with someone who also needs to know this information. And remember, preventing falls isn't about being afraid, it's about being in control.